Last July, Julie Hester hit the ground running as St. Francis Hospital's new president and CEO. She says that St. Francis is a good fit for her, and we'd like to welcome her to the show. And
Thank you.
I'm so glad that you could be here, and we just had a chance to talk a little bit. And I was reading up about, a little bit on your background, and I was just really fascinated, as the process from where you came from to where you are now.
Sure. You mean the fact that I'm a nurse and
yes, and I don't know if most people know that.
No, some people don't, but the good thing about being a nurse in this role is that I know the clinical side of things. I came from, my first job in a hospital, I was saying this to someone this morning, I was a TV attendant. I turned on TVs when I was 16. So
Really?
I've had every job from doing that, various nursing roles in the hospital. I was in intensive care. So it's good to learn it from the ground up.
And this helps you with the everyday administration aspects from your experiences being behind the scenes, essentially.
Absolutely. Well, and I'm one of the staff. I mean, it's great that I can go to a clinical unit. I know exactly how they run. You can learn new things every day. The technology certainly changes. But from a fundamental standpoint and primary standpoint, I know the business, so it's been extremely helpful in my role. I always thought it would be nice if somebody that cared about the patients was in charge. So it's a good opportunity.
That is great.
Yeah.
So tell us what St. Francis is doing to meet the needs of the community, and what is your vision that you're going to this already, the mission that's in place?
Sure. Well, I think, St. Francis has been in this community, we're proud to say, for 85 years. This is our 85th anniversary. And I think, the community's changed certainly since we've started. We were in Little Italy, and I think that now we realize that the majority of the folks that surround the hospital, the zip code that we serve there, is primarily African American and Hispanic. And so we've had to change some of our programs to meet that need. We've focused on women's health.
Mm-hmm.
That's one of our primary focuses. We just opened today. In fact, it's the grand opening of our hospice unit. We partnered with Compassionate Care. And that's the first unit in Wilmington. It's an inpatient unit, first hospice inpatient unit in Wilmington. We also have Select Specialty, which is it's a long-term acute care facility. It's the only one in Wilmington as well. And we have med-surg units, which are just general units for folks to come when they're ill, and we have an intensive care unit. So as far as our vision, our mission is to be a transforming, healing presence in the community, and we'll continue to do that. I think the hospice unit is a sign that we're certainly committed to doing that. So we're going to change with the community.
Now, there are a lot of great things happening at St. Francis, but if you had to say what you think St. Francis does best, what would you say it would be?
Well, I think, that's a tough question. I think that we do care best. I think that we're an alternative to what else is in the community as far as care goes. I think that we have high touch. My goal for St. Francis is to be the best place for patients to come, the best place for employees to work, and the best place for doctors to provide care. So that's what we strive to do every day. And it's a pretty high goal, but I think that we put in our best effort every day, and we'll continue to do that.
What kind of relationship does the hospital have with the surrounding community?
Sure. I think that we reach out into the community as much as we can. We do various health screens, health fairs. The goal is, if you look at from a national standpoint in healthcare, is prevention and wellness. And so you're going to see us do a lot more of that. Me being a nurse again, realizing that we need to go out and get people access for care. And I don't know if you know this either, but we care for the homeless. We have a St. Clair's van. It goes out 4 days a week, and we provide primary care to the homeless in Wilmington. We have a physician that's bilingual on that. It's really a doctor's office on wheels. So we could run that 7 days a week based on the demand. We also have what's called a Tiny Steps program. It's it was to address the low birth weights in Delaware. And the primary folks that we see in that, mothers that we see there, are single mothers. A lot don't have insurance, or they're underinsured. And it's to keep them healthy so that they can deliver a healthy baby.
Right. That's great, and I just love the fact that you coming from the nursing side into the administration side. I really do think it puts a different spin on things.
Oh, it does. You know, I think I envy the folks that come with a business background and they can run a hospital. I've never known what it's like not to have the clinical side, and I always say I'm mostly clinical, and I enjoy it very much. You know, so the business side is something that's necessary, but I think if we care the right way for the patients, the business will follow.
Why would you tell an individual who is given a choice to pick St. Francis over other area hospitals?
Well, I think, again, you know, going back to that high touch, I think St. Francis is a good alternative. We have compassionate care for people. I believe in our nursing care, I think that we've given the nurses the tools and the people there the tools to provide the best care possible. And I think if you ask any of the staff, they would love to have the opportunity to care for the community.
What challenges does the hospital face in the community, and how are you going to work to address those?
Well, I think the biggest thing for us is to be viable, you know, to be a viable entity. We have, you know, the mayor talked about this earlier. I mean, there's a lot of folks that the economy has affected people with their jobs. It's the first time in healthcare that we're seeing it affect healthcare as well, and that's because people don't have insurance.
Right.
They're not getting elective surgeries, or they're underinsured. So it's a different thing. And we need to provide that care because St. Francis's mission is that we will provide that care, you know, day and night for as many people as we have to do it for. However, you know, you have to meet your bottom line. And so that's an ongoing challenge. The goal is for St. Francis to be there another 85 years. That's my goal. And I think with support from the community, support from the city, support from our payers, we'll be able to do that.
Well, congratulations.
Thank you.
And good luck. And can viewers access the hospital website?
Yes.
Okay, so do you want to give that out? Can we get a graphic up for that? And there's also a main number that if you have any questions about any of the programs that we talked about here today, or if you just want to find out more in general about St. Francis Hospital, visit their website or give them their main number a call and they could direct you to different departments. And we're so glad that you could be here.
Thank you.
I mean, really, keep up the great work.
Thanks so much.
And we'll see you again soon, I hope, and talk
That
to us about
sounds
some of the
good.
other programs.
I'd love to.
Okay,
Thanks.
thank you.
Sure.
Up next, a couple of big events are coming up for AIDS Delaware. Stay with us.